Hi, I'm Dr. Courtland Keteyian. I am Vice President for Population Health at Allegiance and President and CEO of the Jackson Health Network. And I am here today with my colleague, Dr. Brian Kim, who you're going to hear from in just a minute. And what we really wanted to talk today about is the increase we've seen in the number of COVID cases here in the community and the impact that is having on us at the hospital. So there's really three main things to touch on. One is to provide an update on where things are at Allegiance, especially in regard to capacity at the emergency department and our wait times there, to really ask for your help in alleviating that pressure by using some of our sites that offer nearby COVID testing, and of course to encourage vaccination in the boosters. That is going to also help us manage this crisis, particularly in the face of the new Omicron variant. So I'm going to now turn things over to my colleague, Dr. Brian Kim, for an introduction and overview of where things stand both within the hospital and the emergency department.
Thank you, Courtland. As Dr. Keteyian says, my name is Brian Kim, and I'm the Medical Director of the Emergency Department here at Henry Ford Allegiance Hospital. I just want the public to be aware of what's going on in the hospital and in our emergency department. We are at full capacity, and that includes our emergency department, and we have over 80 COVID cases presently in the hospital. This is not any different than any hospital in the state of Michigan or nationwide due to the rising number of COVID cases. As the medical director of the emergency department, I think there's two ways the public can help, as Dr. Keteyian has mentioned. One is for those that are seeking just testing alone for COVID, please utilize our other sites for that. There are same-day appointments for that. And the second, I strongly encourage those that do not have the COVID vaccination to go and seek the COVID vaccination. The vast majority of cases in the emergency department that require care and critical care are those that are not vaccinated. I believe by the public doing those two things, we can help decompress our emergency department to provide the timeliness of care for your loved one. I also encourage those that need emergency care to please come to the emergency department. Thank you.
Thanks, Dr. Kim. So we know that there are many people who suspect they may have COVID and are eager to get tested. So I want to actually cover some locations where that's available in the community and how best to access those services. The main one that we have had at the hospital here for very long time now, actually, approaching a year and a half, is the drive-through clinic, and that's an appointment only resource. But it's the phone number there is 517-205-6100, and we have same day, next day available appointments for a drive-through COVID test. So very easy, a very efficient process. So if you do need to get that test done, please do call that number, and we get you on the schedule right away to get a test done for you or anyone in your family. There's also walk-in clinics available at Henry Ford Allegiance. There's 3 walk-in clinics, North Street, Townsend, and Leslie. All of those are capable of doing those COVID tests on site. And then there are other resources available in the community. So the IEP Urgent Care, which is just right up the street across Michigan Avenue, can perform the testing, as does the Center for Family Health. The number of the Center for Family Health is 517-748-5500. And there's various pharmacies that do it as well, and the tests are available now over the counter. So lots and lots of resources available to be able to do COVID testing here in the Jackson community. With the Omicron variant, the best way to really spread COVID really remains, prevent the spread of COVID is really to get vaccinated. And so really want to continue to encourage people to do that. It's very important, as Dr. Kim said, the majority of the cases in the ER in the hospital are unvaccinated people. Over 80% roughly are the unvaccinated in the hospital. We are at a very high level of COVID in this community right now. Our positivity rate is almost 25%, so almost 1 in 4 tests that are done here locally for COVID come back positive. That's an extremely high number. And we have over 4,500 active cases in Jackson County. So just put that in context, a county of about 150,000 people. We have 4,500 active cases. That's actually the most we've ever had at any point in time during the pandemic in the last 2 years. So really at the highest rates we've ever seen. And just to continue to emphasize this, COVID remains very serious. We've had actually over 10 deaths just in the last week. So it's in the county. So people are still getting very sick and unfortunately succumbing to COVID. So very important that we continue to be vaccinated and are testing people frequently to make sure that we're identifying when people are positive. So next week is actually going to be our 1-year anniversary of administering these very safe and effective vaccines. So I want to again strongly encourage individuals unvaccinated to get vaccinated. And if you're due for your booster, people are not eligible for that. So please do make sure and consider getting your booster. Those mRNA vaccines, the immunity wanes after about 6 months, and that's when that booster is recommended. So in closing, just like to thank you for your time, emphasize how much we are depending on our community members to help us right now. And we really need this to be a partnership with the members of the community so we can see this through and be successful. More information can be found on our website, which is henryford.com/coronavirus.